Welcome to Sex Education. In this video, we will introduce the topic of sexually transmitted diseases or infections, also known as STDs or STIs. We will define STIs and discuss how they happen. For more information on each individual infection, please see our other videos. STIs are infections that happen through sexual contact, including vaginal, oral, and anal sex. Some of these are spread through bodily fluids, such as semen, vaginal secretions, or blood, while others are spread through contact with infected skin or hair. There are many specific types of STDs, including gonorrhea, chlamydia, HIV and AIDS, syphilis, trichomonas, pubic lice, scabies, hepatitis B, herpes, and HPV. We will briefly talk about the type of disease that each of these infections cause. Gonorrhea and chlamydia are bacterial infections that affect parts of the genital and sometimes urinary system. They can cause discharge from the vagina or penis, although this is not always present. When untreated, they can lead to pelvic inflammatory disease, which is a large infection of the female reproductive system, and future trouble getting pregnant. They can also cause throat infections as well as anal infections. HIV is a virus that affects the immune system, which is the part of our body that fights infections. Without medications, it can lead to AIDS, which can lead to death from infection. Syphilis starts as an ulcer in the genital area. Several weeks later, it causes a rash that involves the hands and feet. If left untreated, it can affect many other parts of the body years later, including the brain, spine, eyes, heart, blood vessels, skin, bones, and liver. Trichomonas is a parasite that causes trichomoniasis. This leads to vaginal itching, pain, burning, and discharge. Pubic lice, also known as crabs, and scabies, cause itching and a rash in the genital area. Hepatitis B is a virus that affects the liver and can eventually lead to liver cancer or liver failure. Herpes is a virus that causes ulcers and pain in the genital and mouth areas. It can also affect the nervous system and throat. HPV is a virus that causes warts and some forms of cancer in men and women. Many of the infections mentioned can also be spread to the baby of an infected woman and can lead to a host of problems in the child. It is important to remember that some of these infections may be silent and have no symptoms, especially in the early stages. Because of this, adolescents and at-risk adults should have regular screening to check for them. This can be done through blood tests, urine tests, and genital swabs. Preventing these infections can only be done through abstinence or not having sex, fewer sexual partners, latex condoms, or dental dams in the case of oral sex. There are also vaccines for hepatitis B and HPV that are protective. While some of these infections are relatively easy to treat, others require lifelong medications and management. For more details, see our other videos below. The information presented in this video should not be substituted for healthcare, and if you are concerned that you may have any of these infections, you should talk to your healthcare provider. Thank you so much for watching.